Hello to every student who is having an aspiration to learn and to excel as a clinician in their life. Myself, Dr. Shridev, and with my experience, whatever I have learned, I would like to share with all the students and all the aspiring clinicians, and I will be happy if somebody is benefited with this. So I will be putting such videos on a regular interval. But what I want to tell is, because this is the beginning and this is the first video which I am sharing with all my students and those clinicians who really want to prosper in their clinical practice, but sometimes lack of the experience is there, which may act as an hurdle. So there are a few tips which I have learned, and there are many things which I have to learn. Still, I'm still a student in my life, and with my limited learning experience, I just want to share a few things with my students and aspiring clinicians, that a certain attitude is a must. A positive attitude is a must. A positive body language is a must when you are dealing with a patient. And the thing is, how will you develop a positive attitude, a positive body language is the main concern. How will you develop it? So you develop a positive body language and a positive attitude only then when you have a good amount of information, and that information related to your clinical practice, the drugs, the medicines, the patient's pathology, everything comes into this. How clinically you have been experiencing, you have been practicing all those cases, and how you have studied them in detail. So it is basically a combination of both things, your clinical experience as well as your theoretical knowledge about that thing. So we all should always have that attitude in ourselves, that we must always keeps on studying, keeps on acquiring the information which is updated or which is recent, and we must keep on studying the classics, the books which are referral books for us, and at the same time we must try to use them, utilize that knowledge in clinical practice. So therefore, when we are into a learning phase, we must take help of those who are clinically more expertise, more experienced, and who's having a good clinical setups, and they are having good number of patients. We must go to them and we must observe there. We must ask them the questions in terms of learning. So when you learn, when you have a good clinical experience, when you have a good theoretical backup behind that clinical experience, then ultimately it brings a very confident body language within you, a very confident attitude, and that is something to which a patient is always connected to. We all know that we can lie, but our body language cannot lie, and that is something which is a connecting factor between a patient and a doctor. Your body language, your confidence, and your attitude is something which connects with the patient. And when you are confident, you have good knowledge, you have good information, you have good experience, ultimately by default your body language will become positive, and that is something to which a patient connects. And we all have experienced this thing. Even sometimes we move to some doctors. Being a doctor also, we cannot treat everything, so sometimes we have to move to the doctors also. And we have also experienced this factor, that the doctors which are more experienced, which are having good knowledge, they are having a good body language, a confident body language, and a very positive attitude. So that is something which gives us the confidence, yes, this doctor is there and I will be okay with this doctor. So this is my first video. With this I will conclude. I will keep on posting many such videos in future also, related to the clinical examinations, related to the how to take the history of the patient, related to the many other factors which I will be discussing in minute so that we can understand. There are many factors which are very minute and sometimes we ignore them, but they really bring a lots of change in our clinical practice. So I will be bringing such issues in your knowledge after every interval. So I wish you all the best. Keep learning and keep growing as a physician. Thank you.